Hello friends, I am Dr. Himanshu Tyagi, an orthopedic surgeon, and let's today talk about life after knee replacement surgery. So first let's talk about the prerequisites for knee replacement surgery. Normally whenever somebody is having severe knee pain because of knee arthritis and the patient is posted for knee replacement surgery, first we do a complete checkup of the patient in the form of cardiac workup, hemoglobin workup, any infection workup, liver, kidney or any other organ involvement, sugar control, blood pressure control. Normally all these things are done one day before the patient gets admitted to the hospital for knee replacement. When the patient is completely fit from all these point of views and patient is fit for anesthesia, then we plan the patient for surgery. Normally surgery takes 2 hours per knee. So if somebody is posted for single knee replacement, then it's a 2-hour surgery. If somebody is posted for both knee replacement together, then it's a 4-hour surgery. Normally patient needs to stay in the hospital for 5 days. Whenever we do knee replacement surgery for both the knees, patient is in hospital for 5 days. Whenever we do it for a single knee, patient is in hospital for approximately 3 days. When the surgery is done, patient is shifted to ICU post-surgery for observation so that we can keep a check on blood pressure, sugar, patient's vitals. This is a routine procedure and just done for observation. And during this period for pain control, we normally put a epidural catheter, that means a special sort of catheter that reduces the patient's pain to almost a minimal zero. Now when we keep this catheter post surgery for 2-3 days, patient is very comfortable. Unlike the earlier days when patient used to be in tremendous pain after the surgery, these days knee replacement is almost a painless procedure. This catheter is kept for 2 to 3 days, and when we finally remove this catheter, we switch the patients to intravenous pain medicines, and also antibiotics are given throughout the course of the journey in the hospital. Normally intravenous antibiotics are started soon after the surgery and continue for 5 days till the patient is discharged. Normally on the first day after the surgery, patient is shifted to room. When the patient is shifted to room, patient is encouraged to have normal diet. He or she can sit by the bedside with legs hanging. Also we encourage the patient to walk with the help of walker. Normally the patient is able to walk inside the room on day 1. Now as the process continues, on day 2, day 3, day 4, we encourage the patient to walk more using the walker. We encourage the patient to move outside the room, walk with the help of walker in the corridor. And also we start the toilet training. Toilet training means that we encourage the patient to use the walker, walk up to the bathroom, sit on the commode chair, do the daily stuffs, and then the patient should be able to stand again from the sitting position using the walker and get back to bed. Normally by 5th day the patient is comfortable in toilet training and patient is comfortable from pain point of view also. So when double knee replacement is done, that means knee replacement for both the knees, normally we discharge the patient on the 5th day. If single knee replacement is done, then we discharge the patient on the 3rd day. Normally by the time the patient is discharged, the patient is able to walk with the help of a walker till toilet, able to sit down on the toilet seat, get up from the toilet seat, and also the patient is comfortable enough to go to kitchen and prepare his or her tea, coffee or breakfast. Before we discharge the patient, we do the dressing of the wound. That means the surgical site dressing is done before discharge. Normally next dressing is done 5th day from the date of discharge, that means on the 10th day from the date of surgery. And normally between 15 to 18 days from the surgery, we remove the sutures also. Now during the entire period, physiotherapy is of paramount importance. Physiotherapy is started next day of the surgery, and normally we encourage the patient to use walker for first 2 weeks when a double level or a double knee replacement surgery is done. So a patient with bilateral knee replacement usually requires a walker for around 14 days, and for a single knee replacement surgery for 7 days. We normally use a minimally invasive muscle sparing approach for all our patients, in which the rehabilitation is fast, pain is less, as we do not cut any muscle during the surgery, so the rehabilitation part becomes really quick. Normally by 14th day, the patient is very comfortable and is able to get rid of the walker. Normally we encourage the patients to start climbing stairs by around 3rd week, and by the end of 4th week the patient is very comfortable, able to do all daily activities, and is even able to go out of the home for walks in the evening or in the morning. So this is how the life is typically after a knee replacement surgery. A person who is in love with golf or low impact activity can start playing golf by 1.5 months, and normally driving is allowed by the end of 1st month. By driving I mean car driving, not two-wheeler driving. Normally the patient is comfortable, pain-free by the end of 3 weeks, and is able to do all daily activities, even resume office by the end of 2 weeks or 3 weeks, depending on the professional requirement. So this is how the typical life is after knee replacement surgery. If you have any doubt, you can contact us on the number given. We'll be happy to help you out. Thank you.